My daily diet consists of probably just about anything I want to eat. I don't pay close attention to any special foods. I guess I depend on the medication that I take to keep my blood sugar in check, along with diabetic medication. I take medication for high blood pressure, high cholesterol, and other vitamins. My diet should consist of a balance of fruits and vegetables, grains, limited on dairy products, as little carbohydrates as possible, which converts to sugar when it's not used right away in the body. And in a diabetic, that's not good. Too much sugar in the blood causes it can cause nerve pain in your feet. In the last several years, veterans of Vietnam have are receiving Veterans Administration compensation for the time they spent in Vietnam. That was where a herbicide called Agent Orange was used to kill all vegetation, and years and years later, this contributed to some veterans that contracted diabetes. Others contracted cancer and other life-threatening diseases. But I was diagnosed with type 2 diabetes about 17 years ago. Since then, I take several medications by oral medications that I take. I used to use an injection pen that I used several times a day before a meal, but I don't use that anymore. I'm able to control it with the oral medication, and seems to be staying in check. I have a A1C of 6% or less. Usually my blood sugar is in the area of 100 daily, 100 or less. Sometimes my blood sugar can drop too low, which will cause it could cause me to go unconscious and pretty much sound like a drunk. But that's happened to me a couple of 3 times since I was diagnosed with type 2 diabetes, and it's not a pretty thing to watch.